News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. Today we're going to be talking about how addiction affects families. We're going to be talking about family counseling, and we're going to be talking about interventions. And our expert guest today is Gerry Wittman. Gerry is a licensed alcohol and drug counselor. He is a licensed marriage and family therapist. And he is also an interventionist who has led hundreds of interventions and helped hundreds of families help and support and get their loved one into treatment and into recovery. So Gerry, it's great to have you here with us today at New Skills for Living. Thanks for being here.
Thank you for having me,
All
Tom.
right. So Gerry, I think the first thing, the most obvious question is, tell us about interventions. Why do people do interventions?
Right. Well, because we can now. Actually, people have been doing interventions. Interventions have been happening in my professional life for 25 years.
Mm-hmm.
When I first started doing interventions, they were very rare. I think over the last few years, especially with the coming of interventions on television, the series, that kind of stuff, that it's become more mainstream. People know more what interventions are now, so they know that that's an option.
Mm-hmm.
But interventions is a technique. It's a way of bringing families together and working with them to help them get the people that they love and care about the help that they need.
Yeah. So they're pretty effective, Gerry?
They're very effective.
Yeah. And so they're effective, so families would be interested in that, although some families are probably scared to do an intervention, aren't they?
Oftentimes families will ask me, well, what's the success rate, Gerry?
Yeah.
How many people actually go to treatment? And my answer to that, I don't really care that much about statistics, but if it's 5%, really the only thing that matters to you, customer, is your loved one going to go to treatment? So what helps people get to treatment is educated session, making sure the family knows what to do, how to do it, and do it the best they can. So that way, families' interventions are very effective.
I'm wondering though, Gerry, why do we have interventions? Why do people need to do interventions? What's the reason for that?
Well, unfortunately, people that have substance abuse and other kinds of mental health problems don't wake up one day before they get further along in their addiction. They don't wake up in the early stage, middle stage, and say, gee whiz, I think I'm beginning to have a substance abuse problem. I think I better cut that stuff off and maybe stop partying so much, stop smoking weed, or maybe I'll go to treatment and check that out. People don't do that. People have to be pushed into treatment oftentimes.
So an intervention is a way for family members to kind of get their loved one moving into treatment,
yes.
Get some help.
Yes,
yeah.
It's a way. It's an organized way to talk with them in a way that they can say what they want to say in a compassionate, loving way that will help their loved one accept treatment.
Yeah. Now, Gerry, why can families, would you recommend, I know you've done hundreds and hundreds of these.
I have, yes.
You've been an addictions therapist for a long time.
I have.
Do you recommend that family members might watch that television show Intervention and they might then decide to go do an intervention on their own? Is that a good way to go about it?
I think unfortunately that happens. That sometimes family members get together and they say, well, we can do that. Look what they're doing on TV. We can do that. The unfortunate piece is that families divert back into their family system. They relapse, if you will, into their own dynamic. They end up going into the roles that they have in their family. They start pointing fingers and raising their voices, and oftentimes with the best intention to help someone, they'll end up blaming and shaming.
Yeah.
Oftentimes people will say, well, what's the right thing to say at an intervention? And, it really doesn't matter what someone says, but it has so much to do with how they say it.
How they say
Like communication being 80% nonverbal, how you say something is how people hear it.
Yeah. And that's one of the things then that an interventionist such as yourself, that's what you do, is you meet with the family. We've only got about half a minute here, Gerry.
Okay.
but you meet with the family and kind of coach them into doing this in a positive, effective way, huh?
Yes, yes. We rehearse it. We script it. People write letters. There's a whole process to it, and it takes some time, and maybe we can talk about that in the next piece.
So it's not just off the cuff.
It's not off the cuff. The way they're effective is people are educated. If you don't have people educated, then it's going to fall apart.
Great. Well, right after this brief break, we're going to continue to talk with Gerry Wittman about how to do an effective intervention. Well, and welcome back to New Skills for Living. A couple of reminders to you. There are over 80 letters on my website that are free of charge to you that you can read and share with family and friends. This particular one is on how to develop an attitude of gratitude. But that is available on the website. And this television show, as well as many, many others of the television shows that we've done here at Channel 8, the New Skills for Living shows, can be found on the website in streaming video. So to watch this particular show with Gerry Wittman and the other shows, go to the website, and you can continue to observe Gerry Wittman and the other expert guests that we have. So Gerry, to get back to this topic of interventions then, can you go ahead and walk us through the process of maybe from the first telephone call to you and then what happens?
Yeah. So someone contacts me, a loved one.
Yeah.
Someone calls and they say, I have a family member who we are concerned about. How do we get help? Oftentimes I'll direct them to make an appointment, come in and see me, because I want to get a history of what's going on. What are the family dynamics? Who should come to that initial meeting? You know, if there's a mom and a dad, say the person is a 24-year-old male that has a drug problem. I want the mom and the dad and a sister or a brother, or if there's a wife or a girlfriend involved, I'd like those people to come to that first initial meeting so that I can get as many different perspectives as possible about how they see this individual, what their concerns are. So we'll have the first meeting, and at that meeting, it's assessed and determined whether to go forward with an intervention. Just because a family wants to do an intervention doesn't always mean that that's the right and perfect thing to do. So while I'm having that initial meeting, I'm assessing whether we should go ahead and do a formal intervention where we invite people to write letters and come and be a part of that, or if just a family counseling session needs to happen, maybe we just invite the son, the 24-year-old, to family therapy and go that direction. So there's some factors that play in there. But if we move towards an intervention, then I'll send the family home with homework to do. One is also during that initial meeting, I'll assess what kind of treatment, what kind of help would be the best help for this 24-year-old. What program, an intensive outpatient, an outpatient, does he need to see a psychologist, a therapist, or does he need to go away to a residential program, what we have very little of here in this community. So I'll send them home with some homework, write letters, what their concerns are, what their feelings about their concerns are, and what they want to have happen. What's the goal of the intervention? Then we'll schedule another appointment for a few days, a week. Sometimes this process can take as short as a few days if the family is really in crisis, or a week or two if we have enough time. We have plenty of time. So the family will contact a treatment center, or I may give them a referral to one, or they may bring a treatment program with them and say, we've called this place, what do you think of it? If I know of that program, then I'll give them my information, that I know about it. And if I don't know, then I'm certainly willing to call that program, talk with them clinically, and kind of see what's their milieu, what do they do there, what do they specialize in. And depending on what the drug is, there's certain programs that work better with certain kinds of substances. So keeping that in mind as well. Okay, so the second phase there then is to have the family come back and we do a role play, an actual rehearsal. So people show back up for a couple of hours. They're prepared to be there for a couple of hours. They bring their letters in hand. They're ready to read what they want to say to their loved one. So the role play, the rehearsal, is, like I said, a couple of hours long. We go through each person. Everybody listens to other people's letters. How many people are there? It might be the immediate family. There may be some extended family. That's another kind of a call on who are the right and perfect people to be there. We don't want to just fill the room with bodies. You know, we want to have people that that the identified person, the 24-year-old, can hear, you know, people that are important to him. If he's close with his grandfather and his grandfather is available or a short plane ride away, that grandfather might get on a plane and come and be a part of this, you know. So we really want to have the right constellation, the right dynamic, have read our letters, pick the order of how we'll go, contact the treatment center, make sure that everything is in line to go. We don't want to do an intervention and not have any place to go.
Yeah, for sure, for sure. Well, Gerry, you've lined those things out really well. I want to get back with you in this next segment and maybe learn a little bit more from you about where the family's at psychologically and how you help them get prepared psychologically to write these letters and share these letters. And so right after this brief break, we'll continue on taking a look at interventions and family therapy. Hello and welcome back. We're talking with Gerry Wittman about interventions and family therapy. So Gerry, can you tell us a little bit more what you've learned over the years about the psychology of various family members as they're walking into this? I'm sure some are afraid, some are angry, some are reluctant, some are maybe too raring to go. How do you help get them in a place where they can do an effective intervention?
It's very important that the family understands that we're not there to do family therapy, that we're there on a mission. There's a particular piece of work that we're doing. Even though therapeutic issues, you know, people's stuff comes up during, especially an intervention. It's like having Thanksgiving together. You know, everybody does their stuff. So I'm oftentimes continually redirecting family members of why we're here. You know, if the role play is important because a lot of the dynamic will come forth in a role play. Someone's angry with someone, or someone's resentful, and they're just mad as they can be, and they want to tell the person that they're mad, and they've been mad for years because this person's been drinking and acting out and robbing the family of resource or energy, those kinds of things. So family members want to get it off their chest. In a role play, that's a good place to do that. The actual intervention, you don't want to do that because you're going to blow the whole thing apart.
And of course, that's one of the reasons that it's good to have an interventionist like you preparing the family.
Right.
So they get all that stuff cleared out of the way.
Yes.
And then they're able to walk into the intervention and not have it contaminated, huh, Gerry?
Right, right. So when we talk, you know, in the letters and the format of the letters, of having them be, what are your concerns? What are your feelings about your concerns? What do you want to have happen? Now, people don't have to follow that directly, but I want them to have in their mind of, oh, this is what I'm writing about, what my concerns are, and my feelings about my concerns.
So, Gerry, some concerns, might they be like, you've lost 3 jobs, you never see your children, we never see you, you've been in the emergency room, or you've been in jail 5 times in the last 6 months. Those are concerns that people express?
All of that, yes, yes. That you don't come over anymore. You know, we invite you, you say you'll be right there, and it's hours, if at all, that you show up. You've lost weight. What's going on? You used to talk with us, you no longer talk with us. Yeah.
So those are the concerns that are expressed, and of course, as you were saying earlier, Gerry, it's done with a sense of compassion, like you tell the people, the person, like, we care about you and we want you to get help.
Tom, part of this is the family members are learning to use I statements. They're talking about how I feel about this. Not you statements of, you messed up, you know, you're just a dead weight on us. You know, that, you know, so we're not shaming and blaming and trying to make people feel bad. You know, I think it used to be some years ago that the theory was, and the kind of general thinking was, that if you beat an alcoholic over the head and hard enough, then they'll go to treatment. You know, well, you know, I mean, this is the 20th century, 21st century, you know, so we do things differently now. We know what works. Interventions work because you eliminate the enabling and the codependency and other people helping the addict stay addicted.
And I guess you're also saying, and this might be why some families might be afraid sometimes, Gerry, is it's really about compassion. It's really not about coercion.
Right.
And that's the kind of intervention that you do, huh?
Yes. It's very compassionate, very loving. You know, I often tell people, they say, well, Uncle Bob won't want to go to treatment. You don't know my uncle. You don't know my dad. He'll disagree. He won't want to go. I say, you know, it's not important to want to. It used to be, you know, folks would say, oh, you have to want to go to treatment in order for treatment to work. It's just not true. That's a myth. What's true is a person just has to be willing. If a person is willing to go, if a person is willing to get help, then it doesn't matter how you think, how you feel, anything. It just matters what you do. Go to treatment long enough and you change how you think, you change how you feel. That's what they're expert in.
Okay. And then what have you seen then, Gerry, about what has happened with the family or what's happened with the identified patient? And we've got about a minute in this segment, okay?
You know, family, I mean, is critical because families have been living this existence of walking on eggshells, of being scared, of trying to keep everything just so there won't be any acting out on Uncle Bob's part or whoever the person might be. So they're just so hypervigilant about making sure everything is okay. You know, families need help too. Many programs recognize this. They set aside a week for family therapy. But not only that, while the person's gone to rehab or involved in counseling, family members must stay involved in therapy. I do that. I stay connected with family members. I want to be in constant, not constant, but continual conversation with them, work with them, and help set that up for when the person comes out of rehab, if they go to off to rehab, that they have a place to land and begin their work again.
That's excellent information, Gerry. And right after this brief break, we're going to continue talking with Gerry Wittman about this very important topic. Hello and welcome back to New Skills for Living. We're talking with Gerry Wittman about families and interventions, and this is part of our series for 2011 on addictions recovery, and we're really grateful to have you here, Gerry. You've shared some really good information with us so far. It's gone really fast. We're at the last segment.
Yes, quick.
Gerry, what else do you want us to know about the intervention process?
Well, the actual intervention is fairly anticlimactic. I mean, people, you know, we go to the person's house, do the intervention, and people go to treatment. Sometimes what will happen, you get someone's very defiant and must do things on their own, make their own decisions. Sometimes there'll be some kind of little boomerang effect that it may take them a couple of days in order to get into treatment, you know. But what I see is most all the time, people enter treatment. What I'd like to add to that is not to forget the family, because the family is so crucial here. A person has now entered an intensive outpatient, or they've gone off to an inpatient residential program for a month long, or 3 months, or however long it takes. What to do with the family? Family, it's critical that family stays involved with therapy, that they go to Al-Anon or some other kind of sober support network, that they allow themselves to get the help they need. Sometimes family members just want to have a break. It's like, oh great, I don't have to watch that person anymore. I can just, you know, I can have a bath, you know, uninterrupted. Yes, you can, but really now is the work. Now is the work that happens, that people get to work on themselves. So it's very critical in that regard. Follow-up, ongoing aftercare is going to be essential. That the person is not going to be fixed by going off to treatment, rehab, therapy. It's a beginning. The door is open. They have an opportunity to work on themselves, get sober. You know, oftentimes there's things called dual addictions, Tom. There's many kinds of addictions, you know, but dually addicted and comorbid, you know, dual diagnosis, you don't really know mental health-wise what else is going on with the person until they get the drug, the alcohol, the addiction out of their system. So we want to see what the real deal is after drugs and alcohol are gone. You can see that at the end of treatment. Also, I wanted to mention that the interventions are helpful and effective for people with other kinds of addictions. Gambling. You know, there's 6 main addictions. There's alcohol, drugs, food, work, sex, and gambling. So those are the main ones. There's others, there's more positive ones, but those are the main. And, you know, eating disorders, you know, a very difficult, stressful intervention to do. Gambling, you know, has its own elements to it, own challenges, and but there are other kinds of behaviors that can be intervened on.
I'm really glad to hear you talk about how you support the families, because whether this person's like in an intensive outpatient program or residential program, hopefully they're changing and they're getting better. And if they come back to a family that's still stuck in their dysfunction or in their illness.
Or they've just been on a holiday for 30 days, you know, it's like, wait a minute, you know, what to do now?
So you offer support to the families to help them deal with their grief, their fear, their anger, maybe, like you'd mentioned earlier too, Gerry, sometimes they're drinking buddies or they're using buddies. And
Yes, Tom, I've done one family, I did 3 interventions on one family, 3 different people over a couple of year period, all went to treatment. I've done interventions where multiple people went to treatment at the same time. You know, some for addiction, some for codependency. But it's a miracle. It's the magic that happens. For me, you know, I mean, it's the moment when someone goes to treatment, it's like, thank you, God. You know? All right.
And so, and of course, one of the things, of course, I'm sure that you work with families on is no longer engaging in enabling behaviors, encouraging responsibility and consequences on the part of the identified patient without feeling guilty about it.
If you can do that with love.
We got about a half minute.
Okay. If you can do that with love, then you don't mind giving that up. But you know, if you're going to do it with spite and anger and resentment, then you're going to begrudge the person doing their own behavior.
Right. Yes. So. Well, Gerry, this has been great to have you here to come and talk with us about interventions and families, and it's so important that families get into treatment, as Gerry has been sharing with us. I think up on the screen, I think they're going to put up information. If you'd like to go to the website, again, Gerry's show as well as all of the shows in the Addiction Recovery series are up on the website in streaming video. The newsletters are available free of charge on the website as well. In wrapping up again, Gerry, thank you so much for joining us. We can't thank you enough for sharing your wisdom and your expertise and the positive difference that you make here in our community, Gerry. Thank you so much.
Thank you.
And thank you for joining us, and we'll see you next month.